This is Chiu on Health, and I'm your host, Dr. Joe Chiu, and I get to interview health experts in various fields to answer your most burning health-related questions. To submit yours, simply go to chiuonhealth@gmail.com, and that is spelled CHIU on health@gmail.com. Let's get straight to today's question. Hi, and welcome back. Today we have with us Dr. Vitaly Mozeson. He is one of the founders of the disc restoration therapy. It's a very specialized type of therapy that he came up with, and he's going to be expanding on and explaining to us what that is. And he's also one of the very few, if I'm getting this correct, non-surgical spinal decompression specialists in the country who is certified in that particular type of therapy. He's based out of the Bay Area, out of the Peninsula, Palo Alto area in California. And we're happy to have him here today with us. And thanks for coming on.
Yeah, thanks for having me, Joe.
Yeah, absolutely.
Yeah.
So one of the things that I wanted to ask you just from the get-go is kind of what I know what you're into is very, very specialized. And I'm kind of curious as to what led you down that path. What made you become interested in this?
Yeah, no, that's a good question. And there are doctors out there that actually do this type of procedure as something that they do in conjunction with another treatment in the office. But I'm one of the few doctors in California that's nationally certified, which means that we went through curriculum and certain courses to further our knowledge and expand upon our protocols with this type of treatment. So I started my career taking care of sports injuries. I'm close to Stanford University, so I'd see a lot of Stanford wrestlers and gymnasts, and I treat a lot of sports injuries. And I've seen all sorts, but the most stubborn of injuries and the ones that are the toughest to treat are disc injuries and disc-related injuries. And these are injuries that are very severe. They're very painful, and frankly, there aren't a lot of good solutions in mainstream medicine. So I decided to take that on, and what I've done was I came up with a 5-step protocol. It's a non-surgical protocol. It's called disc restoration therapy, and it revolves around something called non-surgical spinal decompression. So that's what we do here. It's more of like spinal disc rehabilitation, non-surgically.
I see. Okay. And you said that you're one of the few who are actually certified, but yet there are others who kind of do this on the side in their practice. Is that right?
Yeah. I mean, there are doctors that, may own a medical device that performs non-surgical spinal decompression, and they may put people on there and have some success, but there's a big difference when you're nationally certified, because you're really able to really select the candidates that you feel are really going to have success with this treatment. And it definitely equips you. It's kind of the difference between, let's say a plastic surgeon that does a little bit of everything, or somebody that, specializes in chins or something like that.
Yeah, absolutely.
So
that's a great analogy.
So, yeah.
Okay. And now, how long have you been in practice for, and how long have you been doing this type of treatment for?
Yeah, so I've been in practice for about 15 years, and I would say the last seven of those years have been dedicated to this treatment. And over the past 7 years, we've been improving upon just simple non-surgical spinal decompression, which has a pretty good success rate. But we're always wondering and testing on ways of how to make it better, how to make it stick longer, and how to really keep people off that surgery table. And I think we actually got it down now to where we have a really high success rate, bordering around 80%, which is high in the medical world.
Wow, absolutely.
Yeah.
Okay. And now I would imagine that if somebody has some sort of pain, let's say low back pain, maybe radiating down their leg, that you go through a certain protocol, I would imagine, to select whether or not they qualify for this type of treatment.
Yeah, you really want to determine what structure is causing that pain and causing that pain down your leg. So we do a series of hands-on tests in the office, and a big test that we do, not in the office, but we refer out, is for an MRI. Once you get an MRI, you can really see what level of the disc is starting to deteriorate or become bulged. And that, quite frankly, is one of the most common causes of pain down the leg. So once you actually determine that and determine the severity, the treatment protocol is very obvious to us, at least, as far as what we're going to do.
Okay, no, that sounds great. And then if for some reason you find that you cannot help that person, what do you do there?
Yeah, I mean, we're surrounded by great doctors. Again, I'm in the Stanford area, in the hub of the most amazing surgeons, and they're just really talented doctors out there, neurosurgeons, orthopedic doctors. And if a person has to visit those doctors at the end of the day, they're in a good place, and I'll be able to tell them that that's where they need to go.
Okay.
But if you could avoid, going under the knife and having all that downtime, then I will inform you that you are a good candidate for treatment. We don't accept anybody that's not. And we'll basically point you in the right direction, whether it's in here with us or whether it's with some of the colleagues that I am surrounded by.
Yeah, no, you bring up a good point because I did interview a couple colleagues who are in your area, and they had mentioned to me that they do refer to you, and that there are many times where you just simply can't help that patient, or they don't qualify for that type of care, and they're very, very grateful that you were able to refer them back to them, and also that you have kind of that network, being that you're in that hub, the medical hub of where you are, to be able to refer them to the appropriate people when necessary. And I think that's a huge asset to have.
It
Um,
is.
Now, let me ask you, if somebody is suffering from back pain, what should they do? Let's say, for example, they've tried icing it at home. They've taken the medication. Maybe they've even gone to their primary, and they're given a prescription medication, a painkiller, anti-inflammatory, but it's still ongoing. It's been there for a couple months, and now they're online looking for different options. What would you suggest a person like that do? What's their
Yeah.
next step?
Yeah, so you kind of painted a pretty good picture. The first few days, you probably just want to let it relax, see if it'll go away on its own. But if, you waited 24 to 48 hours, let alone a couple months, if something is lasting that long, you do want to find out what's going on and taking a detailed evaluation with somebody like myself and getting some x-rays or MRIs done. Because once you get the x-rays or MRIs, you can really see what structure is causing the problem. And then from there, there's no question. The approach is very clear. But if you don't know, it's the unknown that kind of gets people to do things that may be the wrong move.
Right.
So you really just want to dig and you want to find out what's going on. And it's going to somebody that's qualified. You have to do your homework and go to somebody that you trust and that is equipped to take on your problem. But I would probably say, to answer your question, just get a detailed evaluation with some radiographs, and then you'll know exactly what to do.
Okay. So they can go to their primary or whomever to get a referral to get an X-ray or an MRI done, or they can go see somebody like yourself, and
Yeah.
you're also able to refer out for imaging. Is that correct?
Yeah, absolutely. And with primaries, if something is going on for a couple of months, there's not going to be a ton that they're going to have in the way of being able to help. They could put out fires initially with some pain medication, but if you really want to get down into it, you have to go to a specialist. And, we are portal of entry physicians where you could go to us right off of the street. You don't need a recommendation, and we'll be able to provide more answers.
Mm-hmm.
Primary might be a good place to start in the beginning, but then after, if they don't know the specialist, if they say, well, you have to go to physical therapy right
Yeah.
away, and it's a disc, that's not really a winning formula.
No,
You want to
absolutely. Absolutely.
you want to address the disc, but unfortunately, you see a lot of docs that just follow their normal referral pattern, and they will send you straight out to physical therapy for a hot disc, and that's totally not indicated. Why would you want to stretch? Why would you want to strengthen around a damaged disc? You want to stabilize the disc first, and then you build that strong fortress of core musculature around that. So it's just being led in the right direction.
Yeah. No, it sounds like that they want to help, but you
Yep.
know, unfortunately, sometimes because they don't specialize in this, they could be sending a potential patient down the wrong path. And so
They can.
sometimes, even though their intentions are great, but I guess it sounds like that sometimes that's an unnecessary step. They can just go straight to somebody who is qualified in handling this on a daily basis. And
Yeah.
so I guess, if you're one of the very few who are certified to do this type of therapy, how can somebody get a hold of you? Because it sounds to me like, they can't just pick up the phone book and just find somebody in their town. So how would they get a hold of somebody like you if they're in your area, or somebody else in another area who specializes in what you do?
Yeah, so you want to look as far as we go. You can go to the drtmethod.com, and basically it describes what we do. It talks about where our locations are. But if you are in another town, you want to look for somebody that actually specializes in non-surgical spinal decompression. And then you want to kind of find out a little bit of whether they're certified, or whether they just bought a very inexpensive table and they are all of a sudden specialists. So you
Okay.
do have to do a little bit of homework. But as far as if you're in the Palo Alto area, you could reach us by going to drtmethod.com. Of course, you could always look us up too. And if you are in another area, you could actually give me a call, because I know doctors throughout the country that specialize in this, and perhaps I can point you in the right direction if you guys are suspecting an injury that is of disc origin.
Okay, wonderful. Well, I think that a lot of people are in need of this type of non-invasive type of procedure for a disc injury. So
Yep.
I think that we're very fortunate to have you on, and thank you for letting us in into
Yep.
kind of your background and how you got into this. And I think a lot of people are going to be interested in this type of therapy. So again, what is the website? And we'll have it at the show notes. But what's the
Yeah,
website again?
it's drtmethod.com.
Okay.
Yeah. So you could look that up. It gives you a brief rundown of all the steps of how we approach this. It's got our contact information. And thanks a lot for having me.
No, thank you. And so to next time, thank you very
Yep.
much.
Take care, Joe.
Okay.
Bye.
Thank you for listening to Chew on Health. To get your question answered, email us at chewonhealth@gmail.com. And to find out more about our health expert, go to the show notes, or you can visit us at chewonhealth.com. And until next time, cheers to your health and wellness.